Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then we consider what you know of the news of the day. Tonight on the show, we have the Chief Minister of Penang, Chow Kon Yeow. Welcome to the show. It's good to have you back on the show. Thanks for joining us. Now, if I may begin our conversation by looking at the priorities of the Penang state government at the moment. Some states have their own strategies when it comes to dealing with COVID-19. We see in Selangor, there's the Selangor task force on COVID. What is Penang's public health strategy at the moment? What is it making a priority now 1 year into the pandemic?
Thank you, Melisa and Sharaad, for having me back again in Consider This. You have started with pandemic management over here in Penang. In Penang, we do not have a special task force as in Selangor, but nevertheless, the state government machinery is fully committed in working with the National Security Council and also the Penang State Health Department and various enforcement agencies to manage COVID-19 pandemic here in Penang. In Penang, we would like to see restrictions that have been imposed be enforced so that we can reduce the risk of infection. And for instance, the recent Thaipusam celebration, we decided that there would not be any procession or sending off to the temple, but nevertheless, federal government decided otherwise. And I have been appointed to head the State Security Committee on COVID-19 management, and we have been meeting on a regular basis. And right now, I think our focus is to bring the effort down to the district and Mukim level, sort of to micro manage the hotspots so that we can do the 3 T's, that is testing, tracing, and treatment. And I'm not too happy to note that of recent weeks, we have a spike of cases in Penang. It is already 3 days in running. We surpassed the 200 mark. So we hope that this is probably a result of the testing that we are doing amongst the foreign worker in the factory and industrial sector. And we would like to continue with testing, of course, because only through testing we are able to identify the positive cases so that other immediate action can be taken to isolate, to contact trace, send them for treatment.
Right. And when you say testing, granted, more testing means sometimes more cases. Is the Penang government happy to or going to be okay with the fact that the numbers may spike if you continue this approach of testing?
Taking the SOCSO testing program, we are happy to note that we are actually the highest in terms of percentage. We have covered about 51% of those foreign workers registered with PEKESO for testing. And we would say that it is rather slow. This exercise should have been completed much earlier. It is a necessary step so that through this testing, we can be able to identify all the positive cases and take the necessary follow-up action. Yeah.
So can I ask you about the factories? I mean, there's a huge industrial area in Penang. Are factories and factory management adjusting to the new realities? Are they creating production systems that make sense of the need for social distancing and the like? I mean, have you been able to monitor that situation?
It has been recognized that workplace compliance of SOP is not an issue in the factory, particularly the MNCs, even in the SMEs. But factory workers, besides spending 8 to 10 hours in the workplace, have to be transported back to the accommodation, whether in the nearby workers' quarters or staying in a housing estate amongst the community. So that create an issue. While SOP may be easier to comply at the workplace, but the transporting them to and from the factory, how the living condition of the workers' quarters is beyond at the moment, left much to be desired, and that's why the government recognized that with the what you call the ACTA 446, that is the workers' minimum standard of housing and amenities, employers are required to provide better accommodation for the workers so that they can, in this pandemic, social distancing, physical distancing, and all that can be complied, not only in the workplace, but also in places of accommodation and worker quarters.
Right. And what about Penang's healthcare infrastructure? Chief Minister, what has the past year taught you about the robustness or the resilience of Penang's healthcare infrastructure? Has it been sufficient in handling the pandemic this past year? Has more money been pumped into Penang's healthcare systems?
Like the rest of the country, I think we face a situation that with the spike of cases, our public health system had been overwhelmed up to the extent that the health department seek the cooperation of the employers to look into striking a balance. As Sharaad asked just now, if you do more testing, you will have more positive cases. And where do you place them after that? In the
Right.
low-risk COVID center, whether they end up in the hospital wards, or because of the burden on the public health system, we have a new policy, stay at home for those in category 1 and 2 to have this civilian at home. So this is the public health response to the upsurge of cases of COVID-19, and they have to ensure that the public health systems are not overwhelmed because of the spike in cases. We are working hard on a low-risk COVID center. We have just got approval for a 1,000-bed low-risk center in Seberang Perai, Selatan. We have just received news that the allocation has been approved. So our state machinery will be working with the state health department to get this new low-risk COVID center ready to meet the upsurge of cases and the need to place them in such center so that they do not infest other people that keep into close contact with them. Yeah.
Chief Minister, what about the people of Penang? Do you feel that they understand the need for compliance, or even if they are quarantined, understand how to reach out to health officials in order to monitor themselves? Because they, while this stay-at-home quarantine policy is made to fit the infrastructure needs, it also requires people to have an understanding of where how the disease is affecting them, and whether they are getting sicker or they maintain fairly asymptomatic status. What's in place for them to comply with these SOPs?
I think for the public health system, it is under the jurisdiction of the state and federal health authority. But as state government, we have been collaborating very closely with the relevant authorities so that the people are aware that SOP compliance is so important to reduce the infection rate. And for the state government, from the very early days, we have focused our attention on communicating to the rakyat and also enforcement by the local council. And up to now, we are still continuing with this enforcement action. First, of course, to educate, if not issuance of summons, so that the people will be able to be on the same page as the health authority and the state government, that we definitely have to recognize the signs of this virus.
Right.
We have launched our latest campaign. The virus is at your doorstep. If there is no movement, there will be no infection.
Right. Okay.
As a reminder to the people, it is so important to comply with the SOP.
Okay, so educating the public first and foremost. I want to ask you, Chief Minister, how has this past year been different for you in terms of managing the pandemic? I mean, now that we are under a state of emergency, what consequences has the emergency proclamation had on the Penang state government's ability to govern effectively in Penang, considering that all state legislative branches have now been suspended? Has it had an impact on the fight against COVID-19 in particular?
I think I've said earlier in another forum that we can look at the proclamation of emergency in two perspectives. One is, of course, the public health perspective. And of course, the second one is a political dimension. First, we can recognize that with the proclamation of emergency power, we have heard that with that ordinance, the private health resources, asset, and human resources can be mobilized to help the government, the public health system, so that the public health system will not be overwhelmed, and also to increase the power of the authority in taking necessary action immediately without having to amend laws in Parliament. That we can understand if it is used for public health measures, improve our efficiency, mobilize the resources so that we can keep the situation under well control and well managed. However, we do not see why Parliament or State Assembly had to be suspended. It had nothing to do with public health, probably more to do with a political consideration that Parliament do not have to face, for instance, a vote of no confidence. But I don't know why State Assembly has also to be suspended during this period. Having said that, I have not answered the second part of your question. We recognize that while it is necessary for public health measures, the state government has not been impacted greatly. We still continue to function. Every week, we still have our State Executive Council meeting. We have been also invited to join the Sidang Khas of the Security Council on COVID-19 management 3 times a week, chaired by the Right Honorable Prime Minister, where we can highlight issues faced in Penang to be escalated through to this special meeting, so that whatever issues that we face at the state level can be taken up by the federal government.
Chief Minister, can I ask you, what did you raise the last time you went for the meeting? What were some of the issues that you raised in this special Sidang Khas COVID-19?
I don't raise issue every meeting, but I make sure that when I raise, it is of substance. For instance, I raised the need for a grand strategy to face the challenges ahead. I think it was probably 2 weeks ago that I raised it, and I questioned the wisdom of the Director General, Tan Sri Nohijam, over his public statement in that the MCO was for 2 weeks, and he actually asked for 4 weeks, but 2 weeks was granted. But before the 2 weeks is up, he was already advocating the fact that MCO will not be extended beyond 4 weeks. This is the message that he is sending out. I believe it is not too appropriate because people will be looking forward to loosening up rather than tightening the situation. And with the number of cases surging beyond 3,000, 4,000, even very close to 5,000, definitely this is not the type of narrative and optics that we want to disseminate to the people.
Right. Okay, Chief Minister, we're going to take a quick break, but we'll have you stay on the line. We'll come back and continue this conversation on Consider This. Stay tuned. Hi, thanks for staying with Consider This. I'm Melisa Idris. With me is Sharaad, Kuttan, and we're going to continue our conversation with the Chief Minister of Penang, Chow Kon Yeow. Let's take a look at how Penang is dealing with the pandemic in the past year, but also looking forward to the future, how Penang is going to deal with the national vaccine rollout. Chief Minister, where do you see the role of state government in coordinating the national vaccine rollout?
The state government had been given a briefing by the State Health Authority, and the State Secretary has been assigned this important task to coordinate with the Health Authority with regard to the National Immunization Program. Our role at the moment is to facilitate in terms of getting halls ready, and also the facility ready for the vaccination center. Our district office have been assigned this task of identifying, and we have got the list ready and submitted to the State Health Authority for them to consider the suitability of all these center for vaccination to be rolled out next month. Yeah.
Chief Minister, it seems how the vaccination plan includes priority groups. What kind of data does the Penang state government have that will allow it to identify these particular vulnerable groups that need to get the vaccinations first? And are they expected to come to the centers, or will teams of nurses and doctors be going out to those, especially those who don't have mobility, perhaps in care homes and such?
At the moment, we have no details, information about such detail, the logistic requirement, how registration should be done, and so on and so forth. So we are actually wondering, with the appointment of Yang Berhormat KJ from MOSTI to coordinate the logistic of the vaccination program. So far, we have not been engaged by the state minister or his department. Even the state health authorities are also unaware what the minister will do with regard to engaging the various state government and the local authority to get the system ready for vaccination to be done from end of February onwards.
Are you concerned, Chief Minister, that there has been no communication so far? Is this silence worrying for you?
Definitely very concerned. And another matter of concern is while we target 70 to 85% of the population, right now we are not too sure whether all the people will be willing to go for this vaccination. There are people who may not want to opt for vaccination. So all this would require immense communication effort by the government so that the people will be convinced that we have to make sure that this vaccination program achieve the target of 70 at the least and up to 85% of the population so that we will be able to achieve the herd immunity so that the rest of the population will be protected as well.
Chief Minister, it seems paradoxical. People used to be so afraid of the virus, and now they are afraid of the vaccine. But do you sense that they do want to get back to normality, including a lot of their own sort of economic and their economic lives? How are you making the argument to them that this is in fact really the best strategy we have to return to some sort of normality?
Definitely, all of us are caught in this dilemma situation for a very long time. Striking a balance between lives and livelihood may not be that simple, as experienced over the past 1 year would suggest that it is so difficult to strike the delicate balance. And of course, everyone wants to go back to normalcy. Vaccination is one way out, but while waiting for vaccination program to be completed, I think the fight against COVID-19 pandemic is still on. We are still not out of the wood. We have to continue with SOP compliance. Right. The loosening up of the various social economic sector must come together with compliance of SOP, so that the loosening which encourage interactions of human being would not become, each one of us become host to the virus and get ourselves infected, and then with the increase in number, our public health system will again be overwhelmed. And it is a cyclical effect from day one until now, and even until the end of this successful implementation of the vaccination program.
Yeah, so you don't see it returning to normality anytime soon. I want to ask about the economy, the Chief Minister. How is Penang's economy faring at the moment? I'm not just talking about the hospitality and the tourism sector, which I know has been very badly impacted, but what about micro SMEs? What about small businesses in Penang? And if you take a look on the other side of the spectrum, has FDIs in Penang suffered as a consequence of the pandemic and the subsequent lockdowns?
I'll answer the last question first. I think in terms of FDI, in 2019, we achieved an all-time record of FDI investment in Penang. In 2020, we did reasonably well. Statistic up to September 2020 by MIDA, we have 10.6 billion ringgit of FDI, the second highest for the country, and we represent 22% of the FDI in the country. And there will be 47 projects with 9,000 over job opportunity. We know that 2020, we will not be able to achieve or to match 2019. But nevertheless, it is still very good. But our concern is 2021, even 2022, whether we are able to continue this success. We have to work really hard so that FDI in the manufacturing and services sector will continue to be the engine of growth for Penang. Of course, with FDI, the supply chain, the ecosystem, which comprise of SMEs and small enterprises related to this sector will be impacted, yes, but I think with jobs created, with production still in full swing to meet with the global supply chain. We see a situation that can be managed, but with regard to other SMEs in other sector, in the services sector, I think many had been impacted. Tourism and services sector are the sector most impacted, and until and unless travel restrictions are lifted, we will face this situation for yet some more months to come. With that, whether when we cannot receive foreign tourists, whether domestic tourism can be open when situation allowed in the soonest time possible, and it is needed to provide this lifeline to many impacted in the tourism and retail businesses. So all this had to be considered. That's why it is so difficult to strike the balance between saving lives through public health and saving the livelihood through economic measures.
Chief Minister, thank you so much for speaking with us tonight. We've been delighted with your presence on the show, and may we wish you a happy Chinese New Year to you and all our viewers.
Thank you very much for having me.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off the evening.
Don't forget to get the latest news and info on COVID-19 vaccines at astroawani.com and the Astro AWANI app. On behalf of the Consider This team, we wish you happy Chinese New Year. Thank you so much for watching, and good night.